so that our chin actually touches the manubrium or the top of the chest. Okay? We would be assessing them. Can they do it? Does it hurt? Or do they feel some kind of tightness or restriction? Those are the three things I would want to know. Number one, can they do it? Can they get their chin to their chest? And no, it does not matter if you have triple chins. Okay?
At least one of them.
Can they get there? Yeah, you gotta get one of those chins down there. Can they do it? Does it hurt? Or do they feel any kind of tightness or restriction? And these are things we would be making notes of, because it's this assessment that is going to help to drive how you're going to treat. So if you're going to use one of the devices, you need to know where to put it, right? So if they're like, oh, I got a lot of pain right here when I flex my neck, then that may be one of the things I do with her, have her flex her neck while I'm using the device, if I feel like it's appropriate, right? Next one's going to be extension. Now, I want you to watch what I do here, because there's a difference between cervical extension and cervical extension with thoracic extension to achieve what we're trying to go for here. So you should be able to extend only your neck so that your face is about parallel to the ceiling, or within about 10 degrees. If you can't do it, okay, there could be a variety of reasons why. There could be some orthopedic reasons. It could just be tightness, could be pain. So that's why we're asking, did it hurt? Can they do it? And if it didn't hurt or they can't do it, do you feel tightness somewhere? Okay, maybe they feel some tightness in the anterior neck. Maybe they feel it through the chest and the shoulders. These are all things we want to look at, because it's going to drive our treatment. Next one's going to be rotation, and this one's going to be important. I want you to pay attention to rotation, because rotation is going to fit into a test cluster we're going to talk about here in a minute, where if they don't have rotation, it becomes a positive for other stuff we're looking for. So we should be able to rotate our nose bilaterally to within the mid-clavicular line. Okay? So we should be looking at each other. Can we rotate our nose so that it gets to mid-clavicular line? Does it hurt? Can they do it? Do they have any tightness or restriction as they do it? Now, I'm not looking for coupled motion either. I want straight rotation. I don't want to see this or this or this. Okay? I only want to see the head moving. I shouldn't see the shoulders coming up. I shouldn't see the mouth opening. Should definitely not see the face changing. Grunting. Okay? Next one's going to be upper cervical rotation, and this is where it gets a little bit fun. You can look at how C1, C2, C0 move on each other with this next test. So this one's going to be, can they touch their chin to the clavicles on both sides without raising the shoulder or opening the mouth? So can they take the chin down to the clavicle on both sides? I shouldn't see the shoulders come up. I shouldn't see the chest raise up. Shouldn't see the mouth open. Can they do it? Does it hurt? Is there any restriction or tightness when they do it? Again, pain, restriction, and tightness is going to help me to determine where I want to treat. Okay? Now, this is where I want to just hit the pause button real quick. As a chiropractor, if I felt like it was appropriate and I was missing upper cervical rotation, I'm likely going to throw an adjustment into it, right? Some people, that's not indicated for them. If you've got somebody with a connective tissue disorder and adjusting the upper cervical spine is contraindicated, well, now you're left with trying to find something else to get that range of motion back, which is the whole point of this class. Use the tools you have. If you adjust. If you do manual therapy, do manual therapy. If you've got this stuff, use this stuff. But the point is, use what you've got, okay? Next one's going to be lateral flexion. We should have about 35 or 40 degrees of lateral flexion both ways. And I can tell you I'm having significant pain and tightness on my right trap when I do this. Okay, so that would be something I would want to make note of, and even try to correlate to my other test findings. Okay? This next one is probably one of my favorites. I have a neat piece of research to support its use. For those of you still billing insurance, this would also qualify as a neuro test. Okay? Roger, I'm just going to keep borrowing you. Will you have a seat there? Now normally we use pinwheels for this one, right? Hey, there's my lovely bride. Normally I would use a Wartburg pinwheel for this, so if you have one, this would be what you'd use it for, but I use toothpicks in class because they're disposable, right? As a funny aside story, with all the travel that I do, they're a little expensive. I think a Wartburg pinwheel probably runs 20 or 25 bucks these days. And if I'm trying to buy 10 of them, I could do it, but I don't know that toothpicks don't do the job. But if you scroll down to the bottom of Amazon for Wartburg pinwheels, and other people have also purchased, it's sex toys. So I didn't want to look like some weird deviant that gets put on a watch list for buying like 30 Wartburg pinwheels. So that was a defining moment for me. Can you just unbutton your shirt here real quick? Normally we would do this like shirt off or gowned, but I can do what I want to do here with just with his shirt on. Now here's the reason I'm looking at this. We have a lot of reason to believe that some of the pain that we experience doesn't necessarily have to come from the spine. We know that. It could be coming from superficial nerves that have become entrapped somewhere in soft tissue structures. Could be the fascia, could be muscles, skin, whatever. It doesn't matter. The point here is that when we're trying to determine if it's spinal or if it's superficial, if I'm doing all my spine testing, which we're going to do here in a minute, and it's not coming up, it's not giving me what I'm looking for, it's inconclusive, then I can do this test to figure out if I'm dealing with a referral pattern that is a superficial nerve or a peripheral nerve in nature. Very simple to do. So what we're basically going to do is take our toothpick and just do little grids over top of the pain distribution. Now, what he would generally describe that would make me want to do this is, I've been to massage therapy, I've been to therapy, I've been to chiro, I've been to PT, nothing's making this go away. But I'm still getting this kind of referral radiating pain from my neck down to my shoulders. And nothing I can do is going to recreate that. So I'll get my toothpick out here and I'll just do this real quick grid pattern. What I'm looking for is I'm away from his spine and I hit this spot where he goes like this. It's not a twitch, it's a pain reflex. It's a jump sign, meaning I hit something that literally made him feel like I took my toothpick and stabbed him. So we're looking for hypersensitivity. We're looking for allodynia, those things that this shouldn't necessarily be painful, but when I hit it, he's like, ow, why'd you do that? Like, why'd you just poke me? That's what we're looking for here. The reason I like this test is, one, it gives me something else to look at, but two, since we're here in the context of learning a new device, I would absolutely use this device to address that little area of hypersensitivity. I might kind of bullseye it, meaning I'm going to work around it at first, but then kind of drill down right into that point to make the blood flow come in here and kind of flush that stuff out. So I like this test a lot for trying to decide where I want to use the device on the body. This works at the neck, it works at the low back, we can do it down at the gastroc. As a matter of fact, I've got some research coming, or I know of research coming out that suggests if you do this test on the low back for somebody with plantar fasciitis, you may never even have to touch the foot, only work on the back to get the plantar fasciitis to go away. Hypersensitivities in the lumbars. Okay, pretty cool stuff. So again, that's why I kind of like the test. So I've got toothpicks over there. If you just want to do it as a practice, feel free to do that. We'll just take a